Trained as a consultant psychiatrist, and he works half of his time as a consultant for the homeless and also for rehabilitation services. And then the other half of his time he actually works academically and drawing on his background also in anthropology. He also has a PhD in anthropology. And in an interesting way, in his academic work, he tries to bring together these two perspectives and how did you put it beautifully, bring the culture and the clinic
Yes, I think
together.
he's trying to see how the clinic can be made more porous to culture and how anthropological insights can be brought back with questions that are raised from the clinic, but brought back in a way with a certain amount of insight. So, and theorize all the implications and perhaps then generate more sensitivity to local culture
So he's
as
using
opposed to global health.
He's using all the language of someone who works in these intermediary spaces, and it's really a privilege for us to hear that perspective. It's not common to have somebody that wears both these hats. And today he's going to talk to us about some fieldwork he's been doing in Assam in India, and which is really exciting. So thank you very much, and Sushrut's going to speak for about an hour or so, and then we'll have some time for questions.
Yes, I'm afraid this is going to be a dense seminar, so I prepared a slide for you all not to lose track of the names and the case studies, because there are 4 extensive case studies which are systematic biographies of the people, and through that we look at the institutions that have shaped their experiences. We'll do a time check, and if we're running out of time, I'll cut out perhaps one of the case studies, and this 3. That may have an impact on the discussion because case study 3 has been brought into the discussion, but we'll work that out to keep this we can discuss more perhaps. So really this is a short story to the beginning of this is that I've been visiting the northeast of India for the past 17 years, and it's mainly working locally with local ideas, but nothing serious, no grant funding, a holiday. And then over the past couple of years, colleague whom I'm now working with, and this work is jointly with him, Man Barua, who's from Assam and finishing off his DPhil at the School of Geography and Environment at the University of Oxford. He has been working on the political ecology of human-elephant conflict. And at some stage when he got talking, I asked the question, well, what about the impact on human beings and the well-being? And there was literally nothing. So very elephant-centric, and all of the work and conservationists. And the problem with the conflict was that various institutions and disciplines are stuck with how to address this conflict. And it's become quite a serious issue, and it has wider implications which will come up in the discussion on food security, access to healthcare in local settings, and more wider implications of the market impacting these sites, as well as in mental health in terms of the emerging debate on global mental health, which is the latest bandwagon, so to speak, and its outlook on mental health in a way that is very interesting, because if oranges and apples are put together as fruits, then it's easy to say that everyone is a fruit. But it's difficult with the methodologies and the lenses of global mental health movements to scale up models that don't acknowledge that fruits are of different kinds. And so for CBT and antidepressants, for anyone who's depressed, is the standard protocol now, which is sweeping through via the WHO, via standardized methods right across the Indian subcontinent. And that has another part to it. So this is the background to the story, which then need to develop further, because I went into the villages to find out that I could talk to the widows of the elephant fatalities. And as I started speaking to them, we stumbled across something which was a new finding for us. And we realized it's one of the hidden dimensions of the human-elephant conflict, which is the psychological and mental health aspect. And we also found out that alcohol plays a key role in mediating this conflict, which was news. And we decided to therefore interview them, and Man Barua, my colleague, and myself jointly conduct the interviews in a way that was not planned. This is not a funded study. This didn't have a rigorous method at the outset. it was what developed organically. And in classic ethnographic style, you just hang around, talk to people, and then track back people's narratives to institutions that have shaped these narratives. So this took place, the study has been taking place over the last 2 years. I've just returned with a third follow-up of the videos last month from ourselves. And we can talk about that part, which is not something I'm including in today's seminar. So I'll give you a bit of a background to the elephant conflict situation there. This is basically trying to put together various parts. The clinic on the right-hand side and the doctors who record people's sufferings in their narratives. Elephant connection with the clinic while the people who will be there. And I've just returned after disseminating the findings from our study to the videos, because that was something we felt ethically demanded of us. We went back and gave a big summary of what we found out. And so that's the state of Northeast India, the state of Assam where the study took place. I'll show you a more detailed map of the study site later. That on top is an ancient manuscript, which is from the text which Manbara managed to get hold of, and we'll talk a little bit more about it later as well. I put this slide over here just to give you an idea of Wendy Flaherty's very interesting statement that Ganesha, who is the elephant god, those of you might not know, is someone whom she invokes as a way to understand any aspect of human culture. And I put in a footnote there that he was initially both a creator and the remover of obstacles. But the current image of Ganesha is very recent. It's, I think, from the 11th or the 12th century. And if we track it backwards, if we look at some of the coins where there was a period during the Greek rule, or the Indo-Greek era, and Greek kings from the northern part of India were shown to be having the head of an elephant by their side after having killed and decapitated them. And then subsequently the head turned into a mask that people wore. And then that image morphed over time to become a Ganesha. But that's one part of it. If we go through the mythological aspects, then Ganesha has a different story. He's actually the son of Shiva and Parvati, and there are many stories about how he became an elephant. But the common one is that he was guarding his mother who was bathing in a pond and told her that I will look after, protect the place and make it safe. And then Shiva comes along, but he doesn't recognize his father because Shiva has many different avatars or presentations. And one of them is such that he's in an angry state and he wants to see his wife, and this young child of his decides to stop him and put up a fight. It's a very classic Oedipal encounter where Shiva is so upset that he takes off his sword and chops off his son's head without knowing it's his son. And then when Parvati's wife finishes her bath, comes and sees this scenario, she demands and tells him that you killed your own son and I want him back and nothing else. So he doesn't know what to do because once you're dead, you're dead. So there's an elephant passing by, so he chops off the elephant's head and puts it on Ganesha. So that's one of the common myths, but there are many variations to it. And there are a lot of studies around. These slides are actually official statistics, so they are what is recorded. One of the problems called recording in elephant fatality is the engagement with the bureaucracy, the kickbacks, and the high price because there are compensations involved. So the statistics are quite misleading because you have to prove, the widows have to, it's often the men who are killed, and the widows have to prove that this was an elephant-related fatality, which is very difficult. If you look at the widows who are families who are unemployed, displaced, migrant communities, from perhaps Adivasi caste background, for them to engage with health services on the one hand and with the conservation institutions and the forest officials and travel those distances, it's very hard, and therefore this statistics is misleading. So I'll give you a little bit of a background. So at the moment, as of now in India, more than one person is killed every day by elephants. In turn, approximately 100 elephants are fatally injured every year through retributive action by people. Currently, approximately 500,000 families across the country are affected by this conflict. Whilst the ancient elephant, the Elephas maximus, is an endangered species with a global population of fewer than 40,000, 20% of the world's human population lives alongside the elephant's current geographic range. This results in considerable conflict between people and elephants, and with institutions wanting to conserve elephants, and the drivers of human-elephant conflict are therefore manifold. The more proximate causes include loss of habitat and disruption of migratory routes due to deforestation, expansion of agriculture, and human encroachment into protected areas. And these drivers are underpinned by distal causes, which include large-scale development projects and poor environmental governance in elephant-bearing states. I'm talking here mainly around Indian subcontinent. Agricultural fields are the spaces in which most conflicts unfold. Crops such as cereals, millets, and rice paddy consumed by elephants are analogues of what they eat in their natural habitat. Their superior nutritional attributes make them attractive for elephants, and in some contexts constitute a significant part of elephants' diet. Such crop raiding may increase when other food sources are depleted. In India, documented loss of crops to elephants amount from 0.8 to 1.1 million hectares annually, constituting a substantial part of agricultural output in certain states. On average, farming families may lose about 15% of their annual produce. Thus, conflict is an issue about sustenance for both people and elephants. Now, crop raiding by elephants generally takes place at night, as chances of detection and human retaliation are lower. Since losses are disproportionately high for individuals or communities to bear, farmers resort to nocturnal guarding of their fields. This increases vulnerability to elephant attacks, as well as exposure to vectors of disease such as malaria. Sleep loss and fatigue is considerable, with potential effects on morbidity. Crop guarding also results in several opportunity costs, including reduction in wage earning activities and poor school attendance, because children are often involved in crop guarding for night. And it's an extensive, strenuous process that lasts for about 3 to 4 months when the paddy has been at the stage where it is vulnerable to the elephants attacking or other agricultural outputs. And usually it's in the form of a donkey which is put up in the field, and members of the family take turns. Usually it's the men or young kids who have to crop. So wake up here, wake all night there. Exploration of such temporally delayed and social consequences of human-elephant conflict, though vital for understanding the deeper impacts of conflict, remain unaddressed in the literature. Besides raiding standing crops, elephants also attempt to feed on harvested plants stored in granaries or in people's homes by knocking down walls of mud or thatched houses. It is estimated that they damage 10 to 15,000 houses in India annually. Another important factor that leads to house damage is alcohol. Elephants are fond of alcoholic liquor and raid village distilleries where alcohol is brewed and stored. Popular reports of elephants raiding village breweries are widespread. While such descriptions tend to anthropomorphize elephant behavior, they highlight the potential role alcohol plays in mediating such conflicts. The ways in which alcohol binds people and elephants and aggravates human-elephant conflict requires further investigation. Mitigating human-elephant conflict is at the forefront of elephant conservation today. In India, the Ministry of Environment and Forests, which is the MOEF, is the primary body responsible for elephant conservation and conflict mitigation. In a recent report, the MOEF identified installing barriers to elephant movements, for example, trenches, fences, crop compensation, and ex gratia schemes such as measures for conflict mitigation. However, compensation schemes in India have met with limited success. The poor have to overcome several bureaucratic inadequacies to simply produce a claim. Pursuing compensation may expose them to new spaces of institutional inequality. Therefore, how human-elephant conflict generates newer forms of inequality also demands analysis. The MOEF report also emphasizes implementation of better governance models, that involve local community participation and transparency. It recommends increasing 5-year budgets for conflict mitigation from the current US approximately $9 million to $21 million US dollars. Now, there are several barriers to implementing these goals in practice, including prompting collaborations across different governmental departments, and ensuring adequate funds for compensation travel from the center to the ground. However, the policy recommendations of the MOEF report are based on the visible impact of the conflict. Hidden dimensions, such as opportunity costs, health and psychosocial impacts, are unaccounted. Although there is an extant national and local rural mental health policy, ecological stresses are not factored in. A policy framework addressing hidden impacts of human-elephant conflict and integrating them into current health imperatives is non-existent. The published literature so far suggests that human-elephant conflicts are followed by temporally delayed impacts that affect negativity upon the well-being of rural communities. However, a closer inspection of the cultural dynamics of how these impacts unfold and potential frameworks for mitigating them is cursory in the literature. So the next section will draw upon a clinical and ethnographic inquiry into human-elephant conflicts in the state of Assam, northeast India. And what I propose to do is to address how conflicts A, aggravate pre-existing social and institutional inequalities, and B, generate significant psychiatric morbidity. And I'll also pay some attention to the role of alcohol and postulate how it might mediate this conflict. Let me just quickly run past a few slides so that you get an idea. The nature of the consequences, these have been documented. The event in idyllics, the hidden psychological costs, is the focus of today's seminar, which haven't really been addressed so far in the literature, which we stumbled across when we did our interviews with the widows. And here you can see the direct costs as well as the indirect costs, which have been published and documented. And of course, I have not addressed the hidden physical health costs, where I talked about exposure to vectors of diseases, with cockguarding, to malaria particularly. And that is another aspect to it, which there's been some work being done in Africa, but again, it opens up a new line of inquiry for looking at how these aspects impact. And these are just media accounts of how elephants go on drunken rampages, village left reeling after around 70 elephants destroyed 60 homes. On average, the elephants, when they come into the village, and since they've acquired a taste for the local brew, drink about 50 liters. That's the average consumption. And then they go on a rampage. And now they become more instrumental and strategic. So there are more recent reports that they actually come in pairs. One does to the front of the village, the other has a rear guard action at the back. And they close in, and now they selectively knock off just those walls of the hut, where they might find the salt, the millets, and the alcohol, rather than what they were doing earlier. So in a way, if we look at, examine the idea of agency and how that is played out, we are making elephants in newer and newer ways, and reshaping them. And elephants are indeed making us because of what I'm going to be talking about and how that's impacted. That's 6 elephants electrocuted after getting drunk. This was, again, to triad and carpet.
Very sad.
One of the case studies that I'll be presenting, if we had the time to have them, all the 4, he ironically was found dead in the very trench that was laid to prevent the elephants from coming in. So those trenches can cause falls and injuries and fractures for people, including children. And that's from the south of India, which was 2011 last year. We're still getting a lot of reports, so it's, just to give you an idea that it's termed and it's framed as illicit, but it's not illicit. It's local village alcohol that is brewed, and it's safe. It becomes illicit in the eyes of the media and the state, because the regulation of alcohol is through state licensing. Now this is something that Maan dug out, my collaborator on this paper, from the depiction of Lord Krishna, who's trying to tame a very agitated, angry elephant. The point I want you to note over here is that the tail is going up, and that's a sign of aggression amongst elephants. Elephants communicate to each other infrasonically, so they're not audible to the human ear. Now, this is just an example of a mock elephant attack. It's quite a risky video clip, and that's the clip that I felt I didn't have permission to film because an NGO which is working and tracking down this particular elephant has been a theme that I don't put it on the public domain. Yeah.